One of the things that I always tell people is that you really should find your OB before you get pregnant, because you want to build a relationship with someone, and if you meet the first person, they're not exactly who you'd like, you want to be able to find someone that you really like, that you're excited about, before you get pregnant. That would be ideal. And then the other thing, of course, is that you want to maximize your health before you get pregnant. So that means if there's any changes in your diet that need to happen, if there's any exercise programs or things we need to talk about before you get pregnant, and then obviously taking prenatal vitamins actually has to happen before you get pregnant. So one of my mottos is that every woman who's in childbearing age is actually preparing for her pregnancy before you're even pregnant. So you need to take care of your health, you need to take vitamins, you need to do everything you can to think about pregnancy even though you're not thinking about pregnancy. Nowadays, more and more, we're seeing that people are following their career path and then later in life saying, hey, did I forget something? We want to have kids. So your ability to get pregnant actually goes down yearly. So from the age of about 23 or 24, it goes down a little bit. Not a huge amount, not to the point where you should feel completely protected after the age of 35. But the average rate of pregnancy every month for the average population is only about 20%. So we have a lot of patients who are trying to get pregnant and get frustrated after 1 or 2 months of not getting pregnant. The average for everyone in the entire world is about 20%. So every month you have a 20% chance of getting pregnant. It's amazing any of us are even here, actually, when you look at that. So I tell people not to get frustrated. You can certainly look at your cycles, look at the day that you ovulate, but honestly, the best and nicest thing to do is to just kind of hang out and wait. Stress itself can stop you from getting pregnant. So wait the 6 months, and then after 6 months, if nothing has happened, then call your doctor. One of the things to think about, which is not to be afraid of, but certainly one thing to think about, is that all of us, as we get older, we are more prone to other types of diseases, like diabetes and high blood pressure and things like that. And again, that's one of the reasons to make sure you see your OBGYN before you get pregnant, to try to maximize all of those things. If you have your relationship with your physician, if anything comes up, we'll be able to avert any problems with that. But you shouldn't be afraid to get pregnant just because you're not 21 years old. So if you're in your 40s, it's perfectly fine. You just have to make sure that you're following up with your doctor.